Yeah, tell me more about your back. What happened?
I don't know. Last year was on my right hip, the right leg was pain. So I went to my doctors and had MRI done. And he, what he told me is that good news, you don't need a hip replacement. And he prescribed a 5 day package, the prescription, the pain, I believe it's a pain medication it's a steroid, I think.
Hmm.
It's and reduce the pain, but somehow this year, around March and April, the pain switched to my left hip and the left leg. And at this March and April, that was the worst time. I was not able to walk. We went to the Carlsbad flower field, and we I just literally walked for 5 minutes. I was standing there. I cannot. Too much pain. I just want to sit or even just lay down on the ground. It's too much pain.
Hmm.
So I did went to for physical therapist, but somehow only one physical therapist. She worked with me very well, but at that time I don't think I have the MRI for my lump and the left hip, so she cannot actually specifically treat the spot. But I just recently got the MRI done and the for the both part. And I went to Wednesday, went to my doctor's. The I didn't get a chance to see my neurosurgeon, but it was his PA. But he gave me the options. I still keep doing the physical therapist, and all the other options, it's all up to me what I want to do. He said you can do the injection or operation, which is the surgery is it's my last option unless I have to. Otherwise, I don't want to.
Yeah.
Yeah. So and I searched online. I saw your YouTube video. I'm like, okay, I have to talk to this doctor and get some opinions in specifically regarding my situation.
I'm so glad you did.
Thank you
Can
so
I
much.
ask can I ask you some clarifying questions?
Of course.
Um, Between a year ago when you had the hip MRI, you didn't have a lumbar MRI at that time. Is that correct?
No,
You just had
you
the
are right.
hip and that was normal. Okay.
That's
And then
correct.
you got completely better until March of 2023, and then you
Mhm.
started having the pain.
Not completely
Oh, not
better.
completely better.
Not completely better, but it's just all of a sudden just shift to left.
To the left.
Yeah.
Okay. And does it go down the left leg?
Yes, all the way to my lower leg and lower the knee.
Below the
Under
knee,
the, yeah, yeah,
under the knee.
yes,
Yeah. Does it go into the big toe?
no,
No. So it stops on the inner part of the left leg
yes,
and not the right leg, just the left leg.
no, yes.
Okay. And since March, is it getting the pain that goes down the leg into the inner part of the left leg? Is it getting worse or getting better or about the same?
Good news is I think it's getting better.
Definitely getting better.
Just for the past couple of days, I just talked to Phoebe. I'm
Yeah.
doing all the different positions, the
Yeah.
exercises or the sleeping position or sitting position. Just for the past couple of days, my lower leg is no much pain.
Good. But is there any numbness in the inside? There is.
Yes,
Is there a lot of
and
numbness or
if I stand in a certain position, the numbness in my left leg from the hip to the thigh and all the way to the lower leg.
My God, you are just so strong.
What does that mean?
This is usually a savage and disabling pain for most people, and you're just Emily too. Who are you? You're just a warrior. Somehow you're dealing with what in most people would be an unbearable pain. It's just interesting, but for some reason here you are smiling and saying you've got it. But I'll show you why. I'll show you why I think that in a second.
Wow,
Very,
thank you so much.
yeah. I don't know what happened in your life, but you've been made tough, haven't you?
Oh yeah, at that time on the March and April, I could not get off the bed
Yeah.
and cannot even walk over to the bathroom.
Yeah.
I
Well,
I had, yeah,
speaking of the bathroom, I don't want to embarrass you, but I need to ask you about vaginal sensation in your private area. Does the numbness extend in there, or that's normal?
it's normal.
Normal. And
Mhm.
urination, no problem emptying out your bladder, you're peeing normally. I'm sure it's
Yes,
painful to get up and down, but no problem.
no problem.
And you can
Yes.
feel when you have to go, everything's good.
Yeah, unless I wait until the last minute,
Yeah.
then sometimes have a hard time to hold it.
Yeah.
But if I go normal, no problem.
Okay. Okay. All right. Well, that makes perfect sense given what we're about to see. Are you ready to look at the disc?
Yes.
All right.
Yes, I
Let's look at.
cannot wait to hear from you what's going on in my
Uh,
body.
I'll show you exactly. Well, what we've got here is if we start at your back, where this goes up to your head and this goes down to your bum, if we go straight in at the L4-5 level, boom, this is our problem.
Mm,
This is a herniated disc. It's very large. This is the whole spinal canal here, and it's taking up at least half of this spinal canal. You can
wow.
see it pushing a nerve root out of the way. And the reason I say you're a tough lady, Emily, is this is so painful normally. I mean, it just so painful. If we look on the perpendicular level, hey, by the way, not for today, but there's a cyst on your kidney, and
Oh,
your primary doctor needs to get an ultrasound to make sure
okay.
that's not cancer, and it's not. It's like 1 in 100. But in the
Okay.
unlikely chance that it was something, they can fix it easily. And so
Okay.
we would want to know.
Okay.
Okay, we're going down in your spine, and oh, there's the. So this is the normal spinal canal here,
Mm,
and this is the herniated disc here. It's taking up about half of the spinal canal, and it's causing quite a bit of narrowing there.
okay.
It's a lot. I mean, it's a lot.
So it's pretty severe, the situation.
Yeah, it is definitely severe. Um, the problem with a big disc is when the disc comes out like that, your body does a really good job, and yours is doing it now, of digesting that disc and eating it up and getting rid of it and cleaning it out. But when it's bigger, it's a bigger thing to clean out. And at some point, your body just may not be able to do it. You're getting better. There's no question about that. You're getting better. You're better now. You could barely get out of bed in
Yeah.
March, and now you're much better. But it's unlikely, in my opinion, that your body ends up being, the disc is so big that it's unlikely that your body ends up being able to fully digest it. Also, keep in mind the MRI was in June. If they
Mm.
would have done that MRI back in March, it was much bigger then.
Oh yeah.
Still really big, right? But was probably even bigger, which is scary to
Mhm.
think. There
Mm.
comes a time, so basically you have a herniated disc that's causing sciatica. It's a giant disc herniation. And the way that I advise people to think about these is there are three options: wait, which is what you've been doing, have epidural injection, which is good if you're in pain but you don't have a neurological deficit, or if you have severe numbness or weakness, or it's a giant disc and it just can't resolve itself, then you're a good candidate for microdiscectomy, which is the surgery. It's minor surgery, but they go in there and remove the herniated part of the disc. Have you had epidural injection?
No.
I don't think it's going to help you seems like you're dealing quite well with the pain. Epidural is a way of controlling the pain. It's not going to change whether you need surgery or not. So I would not recommend epidural injection.
Thank you.
How old are you?
Do I have to say it right now?
No. Let me ask you this. I'm 57. Are you older than me or younger than me?
Older.
My mom is 80. Are you older than my mom? Are you old enough to be my mom or
Younger.
not? Younger.
Younger.
You don't look like you're old enough to be my mom. I would
Thank
tell you, by the way, and she wouldn't let you. She's happy with the job. So I would say that, and you're in good health, good heart, good lungs.
Yeah. Except I have a high blood pressure.
Okay. Okay.
Yeah.
I mean, I'm on the fence because from a technical point of view, you should wait it out. But the MRI is so big, I feel like you're going to wait it out, wait it out, wait it out, and eventually you're going to have it removed anyway. So it really comes down to how you want to proceed. Your doctor's PA was right. It really is your choice, and you have to decide, is it worth waiting to see if I could continue to get better, or would it be better just to get it over with? And I think the best answer is the one that you in your heart feel works for you. So what do you think?
So let me try to understand what you just said. So my based on my MRI, there's no way the herniated disc in my body it will eventually heal. No.
It may eventually heal, but given the very large size, I think it's less likely than not that it heals on its own. And
Okay.
even if it does, it's going to take a long time, like potentially years, to get better. So it could, there is a reasonable chance that it gets better. And I don't think anyone could put a number on it accurately, but I think it's more likely than not 2 years from now, it's still trying to dissolve.
Okay. So in my case, it's either wait a year to see how the situation it is, or just doing the surgery right now to get rid of. But I watched on your other videos. I think one case that I heard you said it's in 2 year period. Maybe the result will be the same.
Correct.
What about me? In 2 years will be the same, either do surgery or no surgery in 2 years
So
period.
there's a problem with that. There's a problem with that. So that notion that 2 years later, the two groups, surgery or no surgery, they came out the same. But people who had giant discs like yours, they didn't go into the trial. So they just went straight to surgery for the most part.
I see. So how much, what's the pros and cons for the surgery for my case, and how much risk for the surgery, and how long it's going to recover for the surgery, and what about 2 years later? Is this going to coming back?
Great question. So the risk of the surgery is very low. The benefit is that you get better the same day. So all of the pain down your leg, and I don't think it's affecting your bladder, but if it were, all of that would likely go away in one day instead of slowly healing over time or maybe never healing. So the advantage is you speed up the healing process. There is a slight risk of tearing the dura, which is the watertight lining of the spinal canal, or of damaging a nerve root, which could cause a dropped foot or permanent numbness. But those risks are very low. And it's very likely, I think your surgery would be a very easy one, and any neurosurgeon could do a very good job for you. You want to go to a minimally invasive neurosurgeon so you don't have any permanent weakness and you recover fast. So surgery is low risk. It's very likely the advantage is you get better in the same day. The disadvantage is that you have to have surgery. You have to be put to sleep. You get a scar. The minimally invasive surgeons are great, but even they have to dilate your muscle. It takes a few days to recover. So those are all the disadvantages. I think the biggest disadvantage of not having surgery is you may not get better and then have to have surgery anyway. So the way to think about it is if I waited and a year from now I had surgery, the risk you're taking is that year of your life. That's what you have to weigh against the risks of surgery, which are both risks are very low. So if your feeling was, I'm okay, I don't want to have surgery, I'm going to give it a year. If I need it, I need it. I'm willing to take that chance. Then you should not have surgery. If your feeling is, I don't want to be like this for a year. If this numbness on my leg could be permanent, the surgery is low risk, I just want to get it over with, then you should have surgery. And the question is, Emily, too, which one are you?
I don't know. It's hard to make a decision. I have to think about it. But I heard you said I'm a good candidate for the surgery.
For sure. I think if you're not sure, then the answer is wait. You can always decide at any point, you can decide to have surgery, but there's no point at which you can undo the surgery once you've had it. So if your heart of hearts is telling you, I just don't know, that is an answer, but the answer is wait. But then if you wake up one day and you're like, I've had enough of this, I want to get it over with, then call the surgeon and have the surgery. If you get more than 3 months out from the MRI, so if you get into from June to September, they would make you probably repeat the MRI, but that's not that big a deal.
Okay, so how long is the surgery, and how long to recover from the surgery?
Microdiscectomy surgery takes the surgeon about 30 to 40 minutes. And it takes as long usually to get you in position. You have to be asleep under general anesthesia on your tummy because they're going to be working around your nerves. You cannot move. So they have to put in a breathing tube, flip you over. The surgeon's going to make an incision if you get the right surgeon that's minimally invasive, the incision's about that long. They put a tube in there and then they dilate and look down the tube in a microscope, drill off a little bone and then pull out the part of the disc that's sticking out where it shouldn't be. The surgery afterwards, usually people feel a lot better immediately. And the pain going down the leg and the numbness goes away over a period of 1 to 3 weeks. Once that pain is gone, you can start walking. Generally, You want to walk a little more every day. Usually people are walking a mile a day, which takes
Mm,
about 30 minutes within 3 weeks of the operation. You
mm.
you want to be careful about bending because you don't want to cause more disc to come out. He's not going to remove all of your disc, just the part that's putting out where it shouldn't be. And there's about a 10% chance that more disc will come out and it'll ruin the operation that but if that could happen whether you have surgery or not, more so that's kind of not a risk, it's just a reality.
Okay. Okay. So it right now it's on my L4, L5 disc, right? What
Right.
about L3 and L4?
They're fine. It's beautiful.
Yeah, all fine. The only position I need to concern is L4, L5.
Yes.
Okay. And from the both MRI, that's the only place I need to. What about the left hip?
It looks fine to me. I mean,
Okay.
this is your problem. I'm not an expert, but I looked at it and it looked okay. I mean, this is your problem. It's this big herniated disc.
Okay. Okay. I see. So, what about if I want to decide to do a surgery? Are you still do surgery? Can I come to Arizona do surgery with you?
No, I developed tremor, and so I can't do surgery anymore. Where are you?
I'm in California, Irvine, but I'm coming to Arizona to Goodyear. Like I talked to Phoebe, my son is
Oh,
in Goodyear. He's a mental health provider in Goodyear.
good for
So
him. Wow, that's wonderful.
he works there. He works for Guardian,
Oh, nice. Well,
the
I
baseball.
have a minimally invasive surgeon. He's not in Goodyear, he's in Gilbert. It's on the other side of
Oh,
Phoenix.
okay.
But his name is Kofi, and I would let him operate on me.
Oh, wow.
Yeah.
Okay. I will talk to my neurosurgeon to see
Yeah.
or what's the option. And then I'm coming in August the 9th. I'm coming to Goodyear.
Oh, good.
So, yeah.
Well, if you
So,
don't want, if you want to, Dr. Kofi could also see you by teleconference. And then if you do decide you want to go forward, they could arrange it so that when you're here, you can just get the surgery done.
oh, okay. Okay, sounds good.
Yeah.
And you said that the surgery is only take 30, 40 minutes, but the
Right.
recovery will be 3 weeks probably.
Yeah. Most of the recovery is the first 2 or 3 days, but you want to
3 days.
give that time to heal that disc. So
Okay.
couple few weeks.
Are you recommending me for driving to Arizona or I should fly
I don't think you
for
should
this trip?
drive. I do not think
Okay.
you should drive. I'm
Okay.
just afraid you might be okay, but I've driven that. I went to college in Malibu, California. I've driven that many, many times. There's nothing out there. I mean, if
Uh-huh.
something were to go wrong or a bump, what would you? I mean, it would be really tough. So I would
Okay.
strongly recommend flying.
Thank you so much.
You're
Okay.
welcome.
I will take that in consideration. And any recommendations and any other suggestion? What should I do for the time being
I would have
right now?
surgery if I were you. I just think
Okay.
it's too big, and I'm afraid you're gonna wait. And nobody wants to have surgery, but I just feel like when this is all over, you're going to have waited and lost out on a big part of your life that could have been much better. So I would
Okay.
I would just do it. And there's just really, I would not do the injections. I don't think they're going to
Okay.
help you. I think you're
Okay.
very, very high pain tolerance. And
I've been having a lot of pain since last year. I mean, I had a job last year sitting in front of the computer 8 hours a day.
hmm,
And that was I the job ends middle of August last year, and I started have the pain in September.
yeah, I mean, I feel like this is almost a year old already.
Yeah, more than a year old, probably.
Yeah, like it's had it, you gave it a good chance to go away and it didn't. So
Okay.
get it done.
So Should I still keep doing physical therapist?
No,
No.
I can't help you.
Oh, so the only thing can help me to get the pain removed is the surgery.
Or,
basically.
yeah, either your body nibbles it up or the surgeon pulls it out. But the physical therapy, it's not going to remove the disc. It doesn't do anything. So,
Okay, no help. What about the invention table?
no, it hurts really bad with this problem. Inversion table, that's for joint pain because it opens up the joint. But your pain, it
Oh,
will puts traction on the nerve root. It can be really, really painful. So,
no.
no.
Okay. Okay. I heard what you said. I would really consider, but it's a surgery. It's a yeah. Have to a big decision for me.
Yeah, for anyone. It's nice to meet you, and I wish you the best.
Thank you so much,
You're
sir.
welcome.
Yeah.
Talk to you soon.
Thank you. Thank
Bye.
you. Have a nice weekend.
You too.
Thank you. Bye bye.